Okay, we've got quite a packed schedule for this morning, so if that's okay with everybody, we will make a start, and if my colleague Claire can just keep an eye on people appearing in the waiting room, that'll be grand. So good morning everybody, bore da, lovely to see you all. Thank you for joining this session on social prescribing, the first session of what will hopefully be a fantastic week for the Parvo conference and AGM. So we have a number of sessions throughout this week, culminating in the AGM on Friday morning. So if you haven't booked onto other sessions throughout the week and you would like to, please do so. It's going to be a really interesting week with a range of subjects happening throughout, and some expert sessions as well. So this morning, hopefully you're all in the right place. You have joined the session on social prescribing. And with social prescribing high on the Welsh Government agenda, this session was advertised asking you to come and hear about the developments currently taking place and find out what's happening in social prescribing and its benefits. As we all know, social prescribing is part of the programme for government, for Welsh Government, and the intended rollout of a framework for social prescribing in Wales. Work on that framework has been ongoing for quite some time, and we understand that there will be a public consultation on the framework early next year. So as soon as we have further information on that, we will share it with you. We have a range of speakers this morning that have been delivering social prescribing and working on social prescribing in Powys, and I'll introduce them all to you in a minute. And we also have Professor Carolyn Wallace joining us as well, who's been working on a number of aspects of the framework with Welsh Government. So just in terms of housekeeping, I have put everybody on mute. I hope that's okay, just because the number of people that are on the call this morning. And we aim to finish at around 11:30. The setup for the session is we will have our speakers this morning, and we will be starting off, and I'll ask them all to introduce themselves in a minute. But first of all, we'll have Brecon and District Mind, and that will be Dr. Kerry George and Rhiannon Davis. Then we're going to hand over to Sharon Healy from the Community Connector Service, and then Professor Carolyn Wallace will be updating us as well on the understanding social prescribing work that she has been doing with her colleagues. We will then have a breakout into some rooms, and we'll be posing your questions, so please do get involved at that point. And then we will just come back for a roundup of the session after the breakout rooms. If you do have any questions, please put them in the chat pane. You may all be familiar with this Zoom platform, but if not, if you go to the bottom of your screen, you will see a little bubble that says chat. Just click on there and pop your question in. We may not have time today to answer all your questions, but if we don't, what we will do is respond to all those questions in a post-conference email out to you all, and give you all a chance to have that feedback. So please bear with us. As ever, when you're doing the very first session of the week, it can be a little bit daunting, and it is Monday morning, so there we go. So I'm just going to hand over now to our presenters today to ask them to introduce themselves. So Kerry, could I come to you first, please?
Good morning, everybody. And it's great to be kicking off the conference this morning, and great to see so many people on the screen. If you can just wait, I'll just bring up my presentation, all being well. So just to say that the story of our project really began back in 2018 when Public Health Wales published a report, and they were looking into the current state of social prescribing in Wales. And they came up with a number of findings, but among those findings was a concern over the lack of evidence of outcomes from some social prescribing projects. And they also noted that a substantial proportion of the people who've been referred through social prescribing either didn't take up the things that they've been referred to, or they didn't complete the intervention. So this was the context for our project. And following that report, Welsh Government gave funding, and Mind Cymru was successful in securing some of that funding. And there were two main purposes. We were to develop a social prescribing service specifically for people with mild to moderate mental health problems, but they also asked us to provide more robust evidence about what works to improve people's well-being. So this was the start of the project, and we were given funding for 3 years. And so as I say, we're just reaching the end of the project and sharing our learning. But I think at the start of this, I'm sure Carolyn will have a more formal definition of social prescribing, but I thought it would be helpful just to think about what social prescribing is. It's an umbrella term to describe ways of linking people who need support to a wider range of network of services and activities and resources within their local community, which can help their well-being. But I think there's sometimes a little bit of confusion in the use of the term. For us, it was talking about the link worker service, which was actually linking people from the point of referral into those services and activities. But it's sometimes used for the actual activity that people can be referred to, like a green prescribing project, say, run by the Woodland Trust, and exercise prescribing services. So ours is thinking specifically about how you help people from the point of referral, whether they're referring themselves or from a GP, into engagement with those services. So we work together. As I say, I work for Mind Cymru, which covers the whole of Wales, and we worked with 4 local mines, including Brecon and District. And our kind of understanding from previous services that we'd organised is that mental health problems can present additional barriers and can contribute to that non-engagement which Public Health Wales had identified. So the reason why some people might not actually take up a service they've been referred to is because of anxiety or depression, or just not wanting to go out and meet people. So the service was aimed specifically at people with mild to moderate mental health problems, and it was able to provide a kind of a holistic approach and a non-medicalized option for people. So we are delivering the service across Wales, working with 4 local mines in 3 different health board areas. And as I say, Brecon and District, and also in the Powys area, Ystrad Gymlais, were part of that, our project. So the key elements of the model that we developed are, it focused on the way that the link worker worked. And for us, it was really important that the link worker should have both the time and the expertise to work with people with mental health problems. So they needed to have perhaps more time than would normally be available in an ordinary connector service to build up the relationship with the client. And the basic model was to use a what matters conversation. And it's really important that that's about what matters to the individual, not what the matter is with the individual. But the link workers, they weren't able to, they didn't have the expertise to diagnose mental health services, although they did need to know when they needed to refer people and escalate situations. But they did have an understanding of the kind of support needs that people with mental health problems might need. And they were able to work with clients, not only to identify what the client wanted to achieve, but also any of the underlying issues like anxiety and depression that might be holding them back from actually engaging with the service. So the other thing is that people with mental health problems can sometimes have quite complex needs. So our feeling was that they wouldn't just require one pathway through. So we had 5 different pathways offering a range of kind of possible interventions and ways forward. But clients might often need more than one of those, and sometimes they might need, say, a psychological intervention, like doing a mindfulness course or anxiety management, something like that, to help them before they felt able to access other services. So they needed help to manage their feelings. And it's really important as well that the kind of support offered was both practical and emotional. So sometimes people might have very concrete worries about debt or job insecurity and things like that. So it was that combination of support to provide that holistic approach. And I think it's important, especially when we're talking to third sector organisations, to recognise that our project included Uplift Funding, because I think we need to make sure that the services that people need to be referred to are actually there. So we had Uplift Funding, which was to increase capacity on any particular services, or sometimes to provide services that weren't actually available. And the main use of Uplift Funding, the main gaps we noticed for the people who were coming through our project were in those non-clinical psychological interventions, and we were increasing the access to things like anxiety management and counselling. But one of the really important things that came out from the project as well, that was the need. It's not just a matter of identifying what a client might need and then referring them on to the service concerned. Link workers also needed to follow up, to check progress, to make sure that clients were actually engaging, or if they weren't, what the problems were, and help them to resolve them. And also to check whether the things they've been referred to were the right things. And there were occasions on which clients felt that they weren't the right things for them, and they needed to be flexible to adapt and change. So our original referrals all came from GPs, and I think it's important. Mind have done research which suggested that about 40% of people visiting their GP actually have, as part of what's wrong with them, a mental health problem. So GPs have recognised that they need other options other than medication. Some people will need medication in this as well, or it could be that a referral to a social prescribing project will help to deal with some of the things like loneliness and social isolation, which can increase their mental health problems. So like everybody else, we were impacted by COVID. We were going to run an NHS control trial with NHS ethical approval for that, but the NHS stopped all trials not related to COVID. But Welsh Government said we could continue to provide the service to support vulnerable people during the pandemic. However, at that point, we were no longer bound by the protocol, and so we could open up referral routes. So not only GP surgeries, we also took self-referrals and referrals from other community services. Link workers had to adapt to delivery over the phone and the internet. And the service also became flexible to provide either a kind of shorter form, which was more like a signposting service, or the full longer form of social prescribing support. And that mapping of services, link workers have always needed to know what's available for clients in their areas. And that became even more important during the pandemic. You might start with a website like dewch or Info Engine, but actually that knowledge of which services are available in what format and whether they have any waiting lists is invaluable. So it's that local knowledge. And the link workers could also provide access to other local mind services, like the Wellbeing service in Brecon and District Mind. And as I say, we used Uplift Funding to increase availability of counselling and anxiety management. So we're just looking at the results coming in from our project. And as we all will be aware, the pandemic increased mental health problems. At first, there was anxiety around lockdown. Now it's anxiety over opening up and going out again. So lockdown has exacerbated existing mental health problems, but many are experiencing mental health problems for the first time. And it was interesting that some have felt permission because of the emphasis on mental health and talking about it. Some people have come forward to raise historical issues for the first time, and they've been able to do that. So it's good to talk and important to talk. Bereavement, grief and loss have been massive issues. So we provided additional training for our link workers in that. And then there's those issues that have been associated with the pandemic, like alcohol consumption, domestic abuse, finance and debt and things. So these are the results from the service evaluation that we've done. And I feel tremendously proud of the work that the link workers have done to get these results. So if you remember Public Health Wales's concern over people not actually completing or actually engaging with the services they were referred to, 98% of the clients who had the proper social prescribing service said that they had achieved the goals set out in their plans, either fully or at least in part. And 85% of the full intervention clients improved their well-being. We were using SWEMWebs to measure that. So I think, it's important that 81% had personal experience of mental health problems. So we were actually hitting our target audience. Now I'm going to ask Rhiannon to talk a bit about how the project actually ran in Brecon and District, so that you get a local perspective.
So thank you for that, Kerry. So just to introduce myself, my name is Rhiannon Davis. There were some faces there that I recognised on the screen before, but many that I don't. So I am a social prescribing link worker with Brecon and District Mind, and along with my colleague, Dawn Shepherd, we both work part-time, 2 days a week. So as Kerry said, this particular service is aimed at adults struggling with mild to moderate mental health issues, such as stress, anxiety, depression. The service now has been fully up and running for 2 years, and it's become integrated into the existing Martin service. We started the project working in GP practices. I was in Brecon and Crickhowell, Dawn was in Haygarth, and of course all that changed with the pandemic. We're now fully office-based, with face-to-face contact being replaced mainly with telephone, email and text. So Kerry's mentioned a few examples of the sort of issues that people come to the service with. We see a lot of bereavement, trauma, people coming to terms with physical ill health, domestic abuse, breakdown in family relationships, parenting issues, housing difficulties, financial hardship, unemployment, social anxiety and lack of confidence, particularly in young people, loneliness and other lockdown concerns. To be honest, we never know what's going to be at the end of the phone to us. It varies hugely, the list goes on. So Kerry spoke about some of the key elements of the service, but I just want to add more detail as to how we work with Brecon and District Mind, and I'm going to illustrate that with quotes, so we see the voice of people who have actually received the service and worked with us. So as mentioned, individuals can self-refer. We also take referrals through GPs and other healthcare professionals, as well as through voluntary agencies and organisations and family and friends. Initial contact, we aim to be within 2 working days. Contact, as I said, primarily by phone, text or email, but if we feel that actually we need to do it, we will, with the right precautions, see people face to face. So we do try to be as flexible as possible. The approach we take is totally person-centered, responsive to whoever we're in contact with. Each person is an individual, will have different needs, so we respond to them as that individual. And importantly, as Kerry said, we also try to help them to address any barriers that they might experience in accessing the services, which is true is an issue for many. So as regards approach, as link workers, we spend time building a trusting relationship with the client. That's key to it. Having identified their needs, we then use the working knowledge that we have of local groups, services, to help them engage with the relevant support. And at the last count, we've had contact with over 60 such organisations and agencies. The process is very simple for some. It's just some one-off advice and information and signposting. But for most, the process takes up to 6 weeks, often with weekly contact or twice weekly contact, as we discuss ideas, we come up with an action plan, and we set goals and links made. Once those links are made, we then support that individual on that journey. So as link workers, what I say the role that we play, I would say that we mentor, we motivate, we encourage, and where we can, we help to inspire too. And if needed, we will also facilitate and advocate. But the ultimate aim for each person that we work with is, it's really simple, it's not rocket science, it's to give them hope. It's to give them hope and a sense of direction and purpose. It's about empowering those individuals and to help them to build resilience. And in that way, we hope that we can build, for all of us, more resilient communities. So the next slide, I've got a few more quotes to come up. But what I want to do is just give you a few facts and figures about Brecon District and what we've done. So the feedback from clients has been very good, and we have had some key insights, which is why I'm such a firm believer in this work and what we do. The majority of those who use the service are female. Age range spans from 18 to 92 so far. The majority of referrals, 43%, are from patients who've either been referred by a GP or a GP has suggested that they make contact. The average number of contacts are 5. Over 50% have experienced mental health problems in the past, but have not sought support because they didn't know where to go. We use a wellbeing scoring system to show us the improvement in someone's mental health at the beginning of when we start the support and at the end of the support, and that's shown an increase of, on average, 30%. The average feedback scoring rating is 9.6 out of 10. And for those who completed the evaluation, always recommend the service to a family or a friend. And 96% felt they'd achieve what they set out to, either definitely or to some extent. So as Kerry said, the project is due to finish at the end of November. But fortunately, we have been given some additional funding. Mind Cymru has found some additional funding to keep us going. And indeed, last week, we went to the GP cluster group, and they also put in additional funds to keep the service running till the end of March. And during that time, Brecon and District Mind will be deciding what moves it wants to make next in keeping the service going. So I hope that was comprehensive. Yep, last one, contact details. But you can contact me through Brecon and District Mind anytime. Thank you.
And just to finish off to say about what's next, I'm really delighted that the GP cluster has seen the value of the service and is keeping it going in and district. But our main intention now is to try to influence the social prescribing framework that's being developed in Wales. I think our project has demonstrated the level of need there is for social prescribing, which has an understanding of mental health issues. This is absolutely crucial, and we need to have a service which is fit to be able to respond appropriately with link workers, with the time and the capacity and the expertise to be able to respond. I know you've been asked to put questions in the chat, and I'm very happy to stay on to Rhiannon and I can both answer any questions, but you can also contact us out of that if you want to. And our general inbox for social prescribing in Mind Cymru is the one you see there, mcsocialprescribing@mind.org.uk. So thank you very much for listening and for your interest.
That's fantastic. Thanks to Kerry and Rhiannon. And a lot of what we've heard there absolutely resonates with what I'm hearing from organisations that deliver social prescribing across the whole of Wales, actually. And in particular, the things that stuck out for me was Rhiannon saying you never know what you're going to get when people phone up. You're absolutely right. And that often people need more than one intervention, and the complexity of needs as well. And just talking to organisations across the third sector, we're certainly seeing that complexity of ask increasing post-COVID. And also the adapting during COVID. Everybody's needed to adapt. We've had to think differently about how we deliver services. So absolutely, that really stood out. And the assets and community as well. And this is the message we keep giving to Welsh Government, is that with all different models of social prescribing, you need that community asset to link to, and those community assets need to be able to thrive and adapt and build their capacity as well. So that's a real key issue for us. That's absolutely fantastic. I'm now going to hand over, if I may, to Sharon, but just very quickly before I do, you should have, when you joined, had a pop-up box to say that this session was being recorded. And I think that might have not have happened for everybody. So if anybody does have an issue with this being recorded, can you please just send me a private message, and I'll have some conversations internally about what we do before we publish the session on the website. So hope that's okay. If that's okay, I'll now hand over to Sharon, who's going to talk about the Community Connectors model. Thank you.
Morning, everybody. Thank you, Claire. I'm Sharon Healy. I'm the Senior Officer for Parvo's Community Connector service based within Parvo in Powys. So I'm just going to share my screen with you. So Community Connector service is a social prescribing service. It's a signposting and information service. So what is social prescribing? And I know Kerry did touch on this within her presentation. So social prescribing supports individuals with a wide range of social, emotional or practical needs. It's a non-medical model. It addresses individuals in a holistic way. It supports those individuals to take greater control of their own health and well-being. It refers individuals to a range of local non-clinical services to support their health and well-being. And the main focus of it is to improve health and well-being for all that are referred into social prescribing. So Parvo Community Connector service, as I said, is based in Powys. We are an early intervention and prevention service working with individuals to prevent them from going further into support services, so further into health or social care services. We are based within the third sector, and this puts us in a great place, I feel, being based within the third sector. We have lots of great contacts with our third sector colleagues and other organisations and community groups as well, and also within Parvo with the development team as well. So it gives us a great oversight of everything that's going on within the third sector in Powys. We have very strong working relationships with health and social care colleagues, with police and fire services, and as I said, with third sector and community groups. With our health and social care colleagues, we attend weekly multidisciplinary team meetings and virtual wards within health settings, inputting support and advice and information on the third sector on what could help individuals, and then taking referrals to support those individuals through the third sector and through the Community Connector service. We also attend patient flow meetings, and that's quite key now. As you all know, there's such a crisis within the health and care sector with winter pressures approaching. And we are there with being the voice of the third sector, inputting that information, and we're working really closely with our health and social care colleagues to help support them through winter pressures currently. We also attend police meetings, police share information meetings, and again, doing exactly the same, inputting third sector information and taking referrals then for the Connector service to work with individuals to improve their health and well-being if needs be as well. So we attend a lot of multidisciplinary team meetings right across Powys, and our partnership work is quite key to our service. We are funded through the Integrated Care Fund until March 2020. We do know it's been announced there's going to be additional funding for the next 5 years. What that looks like for our service as of yet hasn't been confirmed, but we're quite hopeful that we will be continuous funding in some position, but we're not quite sure what it'll be yet. Who can make a referral in for support into our service? Well, anybody can, as long as they have consent of the individual. It's a simple process of picking up the phone and making a referral across. We don't have no complicated referral form. It's a conversation with either the connector or our duty connector to make that referral across to us, or our social care colleagues actually make referrals direct to us on their WICIS information sharing portal as well. So how we support individuals, very similar to Mind. We focus on the what matters to individuals. We have that strengths-based, person-centered conversation with that individual to find out exactly what does matter to them. We're looking at the circumstances that they're in. We're looking at the strengths they have around them to be able to support their own health and well-being. And we're looking at any barriers or risks as well with them to help break down those barriers and risks to be able to improve their health and well-being. So it's very much focused around them, the individual, and we're just there to support, empowering them and enabling them to co-produce a support plan. We're giving them lots of information, signposting them on what is out in their communities, to connect with their community to improve their health and well-being. So we're very much giving them the right information at the right time. So they're looking for quite a timely response, that we as the service are looking for the best service that can support them in a very timely manner, because it's the information and support that they want there and then. We offer them 6 weeks of support, up to 6 weeks of support. It can be extended if required. Very similar to Breck and Mind, a lot of our, prior to the pandemic, referrals were quick signposting and support. But during the pandemic and since the pandemic, there's been a lot more complex cases coming into the service. So we do offer up to 6 weeks of support, but as I said, this can be extended if required as well. And there's no limit on the number of times an individual can be referred into the service at all, because we know things change in people's lives, and it could be that they've come into us with an issue regarding transport to be able to get to a health appointment or anything like that at one point. And then as they progress on their journey, it could be another presenting issue that they have that they require support with from the community connector. There's no limit on the number of times they can be referred into the service. We use Info Engine, the online information portal of third sector services across Powys, and we also use a lot of local knowledge that we build as connectors to find local support for those individuals as well. So this is a snapshot of all the presenting issues that come into the Community Connector service. We support people with many, many different things, as you can see: community activities, transport, loneliness, shopping support, health conditions, well-being, housing, and much, much more. So as you can see, it's very, very varied support that we offer. Give us a ring if you're unsure, if you want to make a referral for anybody, is what we advise you to do, because we can help find some support and work with that individual to find them local community support if we can. So our outcomes from our service, this is outcomes over the last 12-month period. 100% of people we worked with felt the Community Connector service treated them with dignity and respect. They said they were satisfied with the service that they received from the Community Connector. 95% said they felt that they were responsible for their own health and well-being after the service. So that's the work that we've done to help enable them and empower them to take control of their health and well-being. 90% said they felt that their community is able to support their health and well-being due to the support received from the Community Connector service. So we've informed them what is out in their community to be able to support their health and well-being, and they've taken that support, that signposting or referral support, and gone and received that support in their community. And that's really powerful, I think, that they do now feel that they can get that support from their community. 87% of clients who were questioned said that the support put in place to see their GP was reduced or delayed. So this is having an impact then on the pressures with GPs. So people that are signposted into that service don't feel that they need then to go on to see their GP, which is increasing their capacity then as GP services. And then there's a little bit of feedback there regarding one of the clients that we supported in the last 12 months as well. So how do we deliver all of this? We're a team of 14 community connectors, majority working part-time. I think there's 3 full-time workers. Obviously, due to the pandemic, the majority of the team are now home working, offering that support via the telephone, but they are now going back out doing some face-to-face home visits as well. Prior to the pandemic, we would have been doing a lot more home visits, having that true conversation face-to-face with an individual and getting the true picture from them, building up that trust in the connector as well with the individual. And we think that's really, really important. Connectors are based in either health settings, social care settings, or in a community setting. And we feel that's really, really important that the connectors are based out in communities as well. So the support the team receives themselves, because as you can imagine, it's quite full-on work, very detailed work, and can be quite stressful for them sometimes, especially some very complex work that they're doing. We sit within Parvo Health and Wellbeing team under the leadership of Claire. Myself, I'm the senior officer for the team. Within the team, there are 3 line managers, and those line managers offer fortnightly catch-up sessions to the connectors. They're offered 6 weeks supervision, and the team are offered clinical supervision as well. And we feel this is really important for them to actually de-stress and talk about any complex cases they might have had, and to be able to support them better as well. We have regular team meetings, and what's really important in those team meetings is the team well-being. We're ensuring that that team is okay and they're able to give the support to individuals. And we very often go on team well-being walks and things like that. And we also do a lot of peer support. The connectors support each other fantastically right across. We have an instant chat messaging system. If somebody wasn't sure of what support is out there in the community to support somebody, it's instantly put on our chat, and the support is there instantly. And you can guarantee 5 or 6 connectors will respond with suggestions of where they can go to find support. The team also facilitates locality network meetings, and this is really important because without services out in communities, we can't support individuals. So they facilitate locality network meetings. Why? 1, to build up their community knowledge of what is out in their communities, to offer a place for networking for third sector organisations, for them to come together to talk about what is being delivered in communities, information sharing of good practice we think is really important as well. What works in that community? We've just heard about Breck and Mind and the social prescribing project they've heard. So that would be great information to share within that locality network and the great work that they're doing. And it's lots of information like that of what projects are out there and what is working well for others to learn about as well, not just ourselves. And then we share that information across the team as well. So what might work in Ystrad possibly might not work in Llanfechlin, but there might be elements of that that would possibly work well up there. So those connectors are sharing that information across the team as well. We promote working together, organisations working together, and we're supported by a member of the Parvo development team to look at gaps in provision. So if there's a need in a community which we have identified as a gap, but not been able to support an individual bill, where that is reported within those meetings back to our development team. And then those gaps and that are reported to strategic partnerships as well. So there's a lot of joined up work that's going on via the development team within Parvo. So this is just some key facts regarding the service from April 2021 to date. So far we've received over 2,000 referrals for individuals. Of that, over 1,135 are new clients into our service. So you can see there's a lot of people that come back into the service for support, and we welcome people back in at any time. The average age of the client into us is 60 to 79 years old. You can see the number of signposts and referrals we've made into other service for individuals to access support within their community, 1,821. The gender is broken down there as well, and our referrals of who we get referrals in. Since COVID pandemic, the number of self-referrals has overtaken any other referrals into the service. People looking for that support within their local community to improve their health and well-being. We get lots of referrals from social and health, and also our third sector partners as well, or community groups, and then family or friends. But as I said earlier, anyone can make a referral into the service. In our outcome survey with anybody that we work with, we do ask them who they might have contacted if they hadn't have had the support of the Community Connector service. And as you can see, 34% said nobody. So they'd have been in their community without any support at all. And that's, if they hadn't have accessed any support, that probably would have in time gone, that they'd have had to have gone to health or social care for some support. We can see 28% would have gone to health or social care, but from going into our third sector service, we've reduced that impact on health and social care, or they've returned to family or friends, or they'd have gone to another third sector organisation for that support as well. So that's my presentation. As Claire said, I welcome any questions at all. You can put in the chat box or anything, or if you want to know any more information regarding the service or make a referral in at any time, you can do so on the phone number that's on there. Thank you, Claire.
That's great. Thanks, Sharon. And we'll make sure we share the contact details for Brecon District Mind's Social Prescribing Service and the Community Connectors as well with everybody. So you've got the information after the session today. And really interesting how we see a number of the issues resonating across the two services. And this is just two examples of social prescribing. It really is the buzzword at the moment, and lots of examples across the whole of Wales, all structured slightly differently, all funded differently, some within the third sector, some being delivered through statutory services. So I think it's really an opportune time now to hand over to Professor Carolyn Wallace. Carolyn is a member of the Wales School for Social Prescribing and leads their work, and has been doing some research around the social prescribing models. I'm sure many of you may have already responded to surveys that have been conducted and various workshops that have been conducted. So I'm going to hand over to Carolyn, and she's going to talk to us, and it's very aptly entitled A Wales Picture, Update on the Report for Understanding Social Prescribing in Wales, a Mixed Method Study. So hopefully Carolyn is with us. I know she was earlier.
Yeah, I am.
Ah, there she is. I can see now, Carolyn.
Yeah.
Fantastic.
Yeah, I'm just sharing my slides. Fantastic. Wel, diolch yn fawr pawb. Nice i'ch gweld chi gyd. So lovely to see you all. Well, not all of you, I can't see everybody, but you know, it's great. Lovely to be here. And do you know what? Fantastic presentations, I might add. I've really enjoyed them. I really have. Thank you very much for inviting me. Understanding social prescribing in Wales, as Claire's already said, a lot of you will have either responded to the survey or participated in the focus groups or attended the workshop, online workshop. And I'm giving you the slides today that we presented to the Ministerial Task and Finish group a few weeks ago. And you can see by the logos there that there were a lot of people involved in this. And thanks to Data Cymru, who we subcontracted the delivery of the and the analysis of the survey, and that has fed into the overarching report. And of course, you see Amrita's name there. Public Health Wales subcontracted this piece of work to us in order to help them deliver on the deliverable number 1 for the Ministerial Task and Finish group. So that's the background, basically. And of course, it all fits into connected communities. And I mentioned those deliverables. There are 4 deliverables for the Ministerial Task and Finish group connected to this strategy. The one, as I'll talk to you about today, the second one is around I'm just trying to think of them in order, actually. So I won't give you them in order, because the number 2 is around from HEIW being led, and that one's around the role of the link worker, community connector type role, and all the things that need to be put in place in order for training and education and that sort of thing. The third one is around an online portal, and I had some responsibility in putting some costs forward for that, and we've been having some discussions around that, and it's likely that will end up being some sort of website, central website, which people can access lots of information from an all Wales perspective. And number 4, which is my lead as well, is around the evidence base, and that's specifically around the outcome measures, the work that we've been doing, and some of you will have been involved in this in 2018, around developing the outline outcome framework. So we're taking that a step forward and linking that to a logic model that Public Health Wales have developed, but also the standards. Some of you have been involved in that work, and that's ongoing, and we're linking up with NICE on that, and also things around the evaluation and monitoring and all of that, and core data sets and things like that. So so those are the 4 deliverables. The steering group for the Ministerial Task and Finish group was established in March, and that'll be ongoing. The timeline for that, if Claire hasn't already given you, because Claire, you've joined the Ministerial Task and Finish group as well. So the timeline for that is that the national framework, which the Ministerial Task and Finish group are developing, will be written now over the winter period, and will go out for consultation in the new year. And then once that consultation period has come to an end, it's likely to be launched in July of next year. So we're all being tasked, we've been involved in writing that national framework. And you'll be pleased to know that the model that we've been developing at the Wales School for Social Prescribing Research is at the centre of that framework. We're very pleased with that development. Of course, that piece of work was led by Sally Rees, which was funded by Health and Care Research Wales. So right, back to the main thing. So yes, we did a mixed methods online survey, focus groups workshop. We had representation right across Wales, and what we tried to do was build one on top of the other. So some early findings from the online survey fed into the questions for the focus groups, which then fed into the 6 questions that we asked the workshop. And do you know what? We had some really, really interesting information from all of this. What we found was that social prescribing, as you've just been saying it earlier on, is variable right across Wales. Social prescribing is utilised, defined differently, and of course that causes some confusion. What we found was that there are lots of opportunities as well in doing that, because you're sort of meeting the local need, as is quite right. But the problems with regarding sometimes the underlying philosophy around delivery is a little bit different. So we need some clarification on that. It's not to say that a centralised offer is not what we need, in the sense that we need an outline framework, but actually, local interpretation is really important in all of that. So what we saw, as you can see in those two maps there, is that the total social prescribing organisations that cover each local authority, when we look at it from that perspective, then actually Wrexham provides the highest number of social prescribing organisations with regards to numbers, and Neath Port Talbot the lowest. So Wrexham had 19 and Neath Port Talbot had 9. Now, but if we consider it with regards to organisations per 100,000 population, so adapting it for population, then we find that actually Merthyr Tydfil has the most organisations providing social prescribing per population at 28.13 organisations, and Cardiff has the lowest at 3.52. Now Cardiff recognise that, and I've had recent conversations with Cardiff and Cardiff and Vale because they understand that is an issue. Well, what does all of that mean in a sense? Well, we've got a number of organisations that have social prescribers based in various facilities. But you'll notice by that graph there that the local authority and third sector together are far bigger providers than health as such, and GP practices. Yes, you can see something surprising there. We've got universities now engaging in social prescribing, and this work's being led by Wrexham Glyndŵr University and Swansea University. Both of them have been funded by HEFCW, Higher Education Funding Council for Wales, to start to reinterpret their student services and connect out into communities and work along a social prescribing model. And we've been involved in those developments because we've been evaluating the one up in Wrexham Glyndŵr and transferring those principles down to University of South Wales. And also Cardiff have started thinking about that as well. So, and then in the other, you can see the other there, that other includes community hubs, community wellbeing centres, that sort of thing. So what is really important about all of this, though, there is an opportunity here, a real opportunity for sectors to work together and ensure a really coherent, seamless social prescribing service which meets the needs of its local and national population. Because we do have areas where there are community connectors operating in the same geographical space as link workers, and then or health board social prescribing provision, and they're actually not communicating with one another. It's incredible at this day and age, but that still happens. So we need to be mindful of that. We've got a real opportunity here.
Sorry to interrupt, Carolyn, very quickly. Yeah. I've had a couple of people say they can't see all the slides. If you're having problems, just message either myself or Claire McNiff and we'll try and resolve the problem. I think most of the people have got thumbs up that they can see it. So I'm not sure what the issue is.
Okay, so it says I'm screen sharing.
Yeah, it looks absolutely fine on my screen. I've had thumbs up from other people to say it's okay. It's just one or two are having a problem, I think.
Well, I think we perhaps if we can share the slides anyway after.
Yeah, of course.
And apologies, we perhaps should have shared them beforehand.
That's okay. We'll make sure they're shared. But if anybody does have a specific problem, either message myself or Claire McNiff, and we'll try and resolve the issue.
Okay.
individually, but we'll let you carry on, Carolyn. Sorry to
Thank you. No, that's fine. What I want, if you have a look at those quotes, and I'll read one out for those of you can't see them. And it's understanding of what their actual role is. Like I said, there's a variety. We had 20 job descriptions, different ones I might add, submitted with the survey or whatever, and a lot of different roles come through. If it's that complicated to those that are doing it, the ones sitting on the outside, we stand no chance of knowing. So we had obviously had members of the public as well respond. So in the focus groups. So there are issues that we need to overcome with regards to our presentation of this to the public, as well as making sure that we're communicating with one another. So the social prescribing is a growth activity, and expectations of it are high. They really are. I mean, and you've demonstrated this morning. You know, there are great expectations with regard to social prescribing and its impact on GP surgeries, impact on other statutory services as well. But you can see, there that it's grown, and it's growing even more. Those numbers that Sharon showed you, it's phenomenal how it's gone from, around about 10,000, from 2018-19 to the year 2020 to 2021, well over 25,000. And yes, we note that increase in self-referral, because there are the number, you can see the number of referred and those that were used. For those of you who can't see the slides, there's a difference within the two, and we assume that's a difference because of the self-referral. So we've got a mean number of employees per organisation, where social prescribing was their main role, and that's about 5.6 per organisation on average. And we at that point in time, we had a total of 266 when we did the survey. That's their main role, and then that's across Wales. And as part of their role, very similar, about 6.5 per mean number of employees per organisation, with a total of 267. So very, very close in numbers. So at the salary range between 16,219 to 36,000, and I've asked Data Cymru to have a look at that, because I wonder if that is because of a type of role, statutory organisation employed, that sort of thing. But a mean salary there of around about 24.5. There we go. The social prescribing model, and it looks, so you can see by that pie graph there, that it's the holistic light blue model that is the dominant model. We've got a little bit of signposting going on its own. I'm talking not as part of the model, it's always part of the holistic model. We've got light social prescribing model. We've got, and we've got some a medium size social prescribing model going on there, and various others in the darker blue. So majority are offering holistic social prescribing. Social prescribing provides a broad range of interventions and connects the person to local services and networks. There's no limit to the number of times the person is seen. This is determined by a holistic assessment of the person's needs. And there are what we saw right across all of these was the three aspects of the role which result in connection to community and improve well-being. And that is the referral signposting, the relationship building, we can't emphasize that enough, and maximising the agency of the pathway user. Quote there, we have that what matters conversation, and once we pick somebody up, we will work with them however long it takes. So whereas other services take, say, 6 weeks to 12 weeks, we actually work with people pretty much indefinitely. Technology is key. We asked about national databases. We talked about dewch, info engine, local databases, you know, collecting that most important information about the community services, activities and groups. So there was a mixed response, and certainly Dewis, there was a very mixed response about Dewis, and we've had to provide an additional separate report to Public Health Wales on it for them to have some internal discussions. So you can see there, so they should have a very good database of opportunities. You know, I think we're all in agreement. Dewis certainly isn't one of those. We have a database which is probably 4 times larger than Dewis. We have no vested interest. We just refer the patients to the best place possible for them. And another one, I think we just need to actually promote and get behind one thing, you know. I think all the information is merged between InfoEngine and Dewis now anyway. It doesn't really matter which people choose to put it on, as long as people get the information that they need when they need it. That's the important thing. And participants reported that other professionals such as GPs were also not keen on Dewis. There were some real problems with its functionality. 63% are not moved to a digital platform. Lots of organisations paper-based, and blockers for using technology with GDPR, accessibility, costs, resources, infrastructure, managing multiple platforms amongst different services. And a big quote there, and I'll only just read a little bit of it. It's about commissioning being informed by intelligence as provided or captured by social prescribers themselves. So for example, where gaps have been identified and so other people come through for what matters conversations, or there are gaps in services or assets to refer to them, it should be captured in some systematic way and then provided back as intelligence for commissioning. So it's about connecting the whole system up. Resources, as always, are fundamental to sustaining the social prescribing pathway. And you've already mentioned this in your presentations. Contracts, you know, a lot of you are wondering how you're going to fund these services beyond March of next year. You've had to go cap in hand to get funding in order to make sure you've just got the next few months contracting. Well, do you know, surprise, surprise, number of fixed term contracts by contract length, more than 6 months and up to and including 12 months, and that you can see by that graph. That's as much as people are getting. Few are getting over 24 months, and some are only just getting up to 3 months. So there's some quotes there on the left-hand side. I'd say that's about us as well. Everyone wants to do an outstanding job and deliver an outstanding service, and the contracts are so tight that that's not possible. So you get a weaker version of what you're delivering. An impact of that are turnover of staff. People, you know, have got mortgages to pay. People have families to feed, and so they need to make sure that they've got jobs to go to. And that's what people have been worried about, is losing really good staff throughout this process. Community assets, again, something you've already said. The number of organisations you can see there and the community assets. And so we're talking about mental health support is the big one there, with a lot closely behind. And a quote, there's no point us having loads of referrals from GPs to keep them out of GPs, out of University Health Board, out of social services, if you've got nothing in the community. Community has to be strong, and we use the assets that are already there. You know, it's really important that we remember that this is a whole pathway and not just about link workers. You know, if link workers can make the prescription, who delivers it? Actually, it's the community assets who deliver it, and that's where the impact is. So those are the really important things. So we made a number of recommendations around the national framework. That's, you know, there's lots of evidence there to say that we need one. Local regional organisational structures and partnerships should consider the role of a social prescribing champion to drive regional social prescribing strategy and coordinate communication throughout the pathway. Whole system approach to developing and delivering the social prescribing pathway, which is informed by intelligent commissioning, should be adopted, and to review the role and scope of the social prescriber to understand what should or should not be included within it. and its point of referral onto the services such as mental health and social work teams. There are some issues within the interface between the social prescriber per se and those statutory roles in mental health and social work. To provide a professional infrastructure for social prescriber, which includes, for example, a suite of job descriptions, salary guides, skills and competency framework, supervision requirements, and recognised training education opportunities, which I'm pleased to see are now emerging. To evaluate the usability of the National Single Digital Directory for Wales, such as dewch and InfoEngine, digital platforms such as Elemental, that sort of thing. And to ensure that the specific needs of social prescribing services are being addressed, and to reconsider the funding model used for social prescribing to promote a sustainable pathway for the future. And what we've asked is that we repeat this exercise in the next 5 to 10 years to understand how social prescribing has progressed against these recommendations. And that's about it. I think I mentioned these already. The future, we also want to do a deep dive into one area, and Cymtaf Morgannwg have offered that opportunity for us. We just need to sort that out, but others are coming forward as well. This is the first sort of study that's ever been done in Wales around social prescribing of this nature. With any survey, it's only as good as those people who gave us the information. It did cover all areas in Wales, but we understand that there may have been gaps, but it's a good starting point. There we go.
Lovely, that's fantastic. Thank you, Carolyn, and a huge amount of work, as you can see, that has been going on to get that basis of information which will inform that framework going forward. And I'll be working closely with Carolyn and her colleagues to ensure that opportunities as we go along with the rollout of the framework are made available for people to engage with that piece of work and to inform it. And please, when those opportunities do become available, as Carolyn said, the information is only good as the information we're provided. So please do take part in that. It was absolutely fantastic. One evening last week, myself and Carolyn and colleagues actually joined a meeting of WSPA, the Wales School for Social Prescribing International Advisory Board, and we were talking to colleagues in, we get it right now, Australia, France, Germany, the Netherlands, about the different models of social prescribing, and it was absolutely fantastic. And I think they were quite enthused by the work that's been taking place in Wales. So thank you to everybody that's contributed so far. Time is pushing on, so huge thanks to Carolyn, but we're going to break now into some breakout rooms, and we have a question we would like to pose for that. And we're going to be in the breakout rooms for just around about 10 minutes. And Claire is going to automatically put us into the breakout rooms. If there's a Parvo colleague on the breakout room, if you could take notes, please, and share with me afterwards, and we'll make sure everybody has a copy of those after the session due to the time. But the question is, drum roll, how do you feel social prescribing is developing in your area of work, and what do you feel are its benefits? So that's going to be the question which Claire will also put in your individual group boxes, so you'll be able to see that. So hopefully the magic of Zoom will now make us all disappear into rooms. Yeah, I understand that some people need to head off, that's fine. So if you are in a room, we shall see you back in a few minutes. I'm sorry, I was in full flow to my group then and then got cut off. I think everybody's back with us. So have we got everybody, Claire? Lots of us called Claire, it gets very confusing, but okay, I think we're okay. So huge thanks. As I was just saying to the group I was in, time has really run away with us today, and I really feel there's been a real rich conversation around social prescribing, and one that can probably continue. So we'll have a discussion about what that might look like in the future, but thank you all for coming along and taking part today. A huge thanks to all our speakers, to Kerry, Rhiannon, Sharon and Carolyn. As you will all have noticed, there's a huge amount of work already happening around social prescribing in Powys, and there's lots of other work already happening around green prescribing, for example, out in communities. So I really feel that this is an area and a subject that is going to continue to grow, certainly over the next 12 months and into the future. And we will endeavour to keep you all up to date with the developments around the National Social Prescribing Framework and what that might look like. And as I said earlier, please do keep an eye out for that information and to take part in any focus groups that come up or any surveys, because it really does inform the work going forward. We're now, hopefully, I know people are having to hop off, we're going to share very quickly a poll, if you wouldn't mind. It's one question, nice and simple and straightforward. So if you could do that. And if you are, as I mentioned earlier, into tweeting and stuff like that, if you could take a couple of minutes of your time at some point today to tweet about today's session, that would be great. There's the poll. Please be as honest as you can, that'd be great. And no doubt there'll be a further questionnaire around the feedback for the whole of this week coming out to you all. So do participate in that, because it really helps us to design these sessions going forward. So thank you. And as I mentioned earlier as well, there are a number of sessions throughout the week, so please do take a look at the Parvo website, and if you'd like to join a session, please do get in touch. There's another session this afternoon around circles of support with Mark John Williams, which again is likely to be a really interesting session around how we can build circles of support around individuals, and lots of sessions throughout the week, so please do take a look. We will, after the conference, and it'll probably be into next week, feedback in terms of any questions that were put into the chat pane, and share the presentations with you for future reference as well. If you do have any more questions that you haven't had a chance to ask, please pop them in the chat pane. We will keep the room open for a few more minutes to allow you to do that. But once again, a huge thanks to all the speakers. Thank you to my Parvo colleagues for doing lots of work in the background to make this session, get it up and running. Always daunting first thing on a Monday morning. But a huge thanks to my colleagues for all their help. And that is it for today's session. Finished in time, which is amazing, actually. We could have carried on talking a bit longer. But thanks for all of you for attending, and have a great day.